I am an assistant professor of nursing at Towson University in Maryland, and then I'm a per diem nurse at Sheppard Pratt Hospital in Baltimore on the inpatient trauma disorders unit, where we treat adults who have survived really severe abuse and neglect and maltreatment in childhood. And they have diagnoses like dissociative disorders, anxiety disorders, PTSD. Our inpatient program is designed to promote interaction. We want patients to interact and to learn and grow. And of course, with the pandemic, we've had to limit contact. Things have been a lot more isolating, so folks can't all be in the living room together. They can't all eat together. We know that isolation actually worsens mental illness symptoms. I think initially we saw an increase in need for psychiatric care when things were really starting to shut down with the pandemic, because it was scary and folks were cut off from their support systems. And how long is this going to last? How long am I not going to be able to see my therapist and have to do therapy over Zoom, which, is helpful, and that's great. We've, been able to access a lot more folks by doing therapy and doing care virtually. But for some people, it's not the same as being in the room with their provider. Things are starting to get back to normal on our inpatient unit today. So we are allowed to have more folks grouped together in rooms, so they can see their peers. They can actually sit with their doctor in a room and have therapy. They're happy that things are starting to open back up. I think there is still fallout to come. I still think that we are looking at months and years of support that folks will need as a result of the pandemic. Prior to the pandemic, there were not enough inpatient psych beds, period, for anybody, anywhere. It's really hard to get psych care, especially if you happen to be living in poverty, or if you live in a rural area, or any other number of special groups that have a hard time accessing psychiatric care. So it does weigh on you when you think about all the folks who need care and who need support and you're not able to give it. There are some positive things happening as far as more facilities making space for folks who need it, and I'm really passionate about psychiatric mental health nursing. We need nurses everywhere that are going to be more compassionate to folks with mental health needs. Patients that come to our unit for care are some of the most resilient folks that I've ever encountered. And when they come in to get care, they work really hard to get well and to get back to that. And it's just really inspiring to see them go through that journey and have such great outcomes at the end of it, despite all of the hardship they've been through.